Tensions and mitigations, understanding concerns and values around smartphone data collection for public health emergencies. Our study built on previous exploratory work to examine people's opinions and reactions to the utilisation of data held on their smartphones by the state during public health emergencies. This might be health, location, or message data, for example. We were interested to know, firstly, how people react to consented and unconsented mobile phone data or mobile phone data mediated data collection for public health purposes. Secondly, how do the values and reactions depend on scenarios with different public health emergency relevance? And thirdly, in what ways do traits and positions around general values of privacy and civic engagement influence values and reactions? Like in a previous foundational study we had undertaken, we based our inquiry around 3 scenarios of increasing public health severity. From non-communicable heart palpitations through moderately contagious meningitis to an influenza pandemic. Given the timing of the study, 2 months into the UK's initial lockdown, we augmented questions about these 3 scenarios with supplementary questions seeking participants' views on data access and consent relating to the COVID-19 virus pandemic situation. The survey was executed online using Prolific for recruitment, with screening to target a UK-only adult demographic, structured as shown here, but described more fully in the paper. We undertook a 3-stage mixed methods analysis of the collected data. In stage 1, inductive thematic analysis on responses to the open-ended questions. And in this, we conceptualized an overarching theme of lockdown may unlock the data, describing how coveted personal data should be protected and thus locked up, but the wider societal need is perceived as a reason to unlock and share the data, and where lockdown acknowledged the situation at the time of data collection. In stage 2, we used quantitative analysis of the Likert scale responses to examine between scenario comparisons for each question and between question comparisons for each scenario, and reactions and values to the COVID-19 virus situation. We found a lack of strong correlations in pairwise comparisons, leading us to consider whether there might be groups of properties or groups of participants that would provide greater insight into how traits and positions influence values and reactions. Consequently, we used clustering analysis of the aspects with most variance, which were related to pandemic-related question responses, and this identified 4 groups whose participant numbers had most similar responses. In stage 3, we considered the qualitative data associated with each group to see if this gave any more nuanced characteristics. We re-examined thematic analysis coding by participant by group. In the paper and supplementary materials, we provide high-resolution images showing the relationships between thematic analysis codes and group members, using shades of grey and colour to highlight different value ranges. This led us to some greater insights and more detailed descriptions. From this, we derived 4 characteristic user groups that can inform considerations for design and development activities in this area. We provide a diagram included at larger scale in the paper and supplementary materials, which illustrates the overlaps between the cluster segmentation variables and civic engagement and privacy concern. We identified these groups as Group A, civically engaged and concerned about disease prevention; Group B, sensitive to particular healthcare applications and most concerned about privacy; Group C, willing to share and believe data will be helpful, but consent is important; and Group D, Privacy law matters. The data is not useful and very wary of misuse. The study indicates concerns and considerations people have when they specifically think about sharing data from their smartphones to participate in public health emergency response activities, based on their experiences and thoughts. It highlights tensions between privacy, lawfulness, consent, mitigations, and sense of duty. Our findings provide additional understanding on the nature of concerns about data access and consent. We identify implications for the design and application processes of public health technologies, for supporting citizen collaborative data collection and responses to the control of highly communicable diseases. These implications highlight participants' desire to understand the purposes and use of data, the need for consent, and the importance of mitigating controls. However, there are a core of people who are not yet convinced about data being used for public health purposes, no matter what the imperative, for whom the risks outweigh any form of sharing. Please do get in touch with me or my fellow authors if you would like to discuss our work further.